I'm Dr. Michael A. Pikos, and I'm here to share with you the top 8 reasons you don't want to miss our new continuum. Reason number 1, this continuum is a true continuum in every sense of the word. Now, what do I mean by that? Well, what I mean specifically is the fact that there's common thread in one module to the next. Our program consists of 4 comprehensive modules, and yes, in fact, there is continuity despite the fact that each of these modules is a standalone module, yes. However, the continuity element is very important in my humble opinion for a number of reasons, not the least of which is reinforcement of material that makes sense. And there's a common thread throughout these 4 modules, that being basically me, Pikos, being the head of this program, and with my all-star faculty, we'll be sharing with you comprehensive material that is very practical yet evidence-based and will allow you to implement this material on Monday morning in a very confident manner. In addition, the fact that I'm still practicing is very important. As a practicing clinician, very active with my clinical material, clinical patients, what have you, I'm able to share with you very cutting-edge technology that I'm very actively involved with still, and the fact that I'm able to share with you 4 decades of experience. This is very important because, quite honestly, there is really not a program that's available in our country that will give you this same background in terms of experience and continuity. Reason number 2, 4 decades of clinical experience and still practicing. What does that mean? Well, in essence, what it means is that I will be sharing with you 40 plus years of my clinical work, and I'm still practicing. I think this is very important. This differentiates us really from every other program that's available in terms of a continuum to more or less target and look at the fact that we want to have entry-level clinicians coming to us and those who have limited implant experience and want to learn more about foundational implant dentistry. So that's a lot of experience, certainly. And that in and of itself may not mean a lot, but the fact that my institute is now 34 years old, we have almost 7,000 alumni, that's almost 7,000 individuals that have trained that are clinically active with the material that we have shared with them from all 50 states and 67 countries. What does that mean? Well, it really means the following, and that is we have long-term follow-up on essentially every aspect of this continuum to share with you, so that it's not just, well, this kind of works maybe because of the last couple, 3 years we've been looking at it, I've been playing with it, etc. No. Everything that will be shared with you during these 4 comprehensive modules is based on sound, evidence-based work and an N of a large number. By that I mean having placed more than 35,000 implants in my career and counting, having done more than 1,000 block grafts, more than 1,500 lateral wall sinus grafts, hundreds of crestal sinus grafts, a gazillion soft tissue and alveolar ridge augmentation procedures, etc., etc. What does all that mean? It means basically that, and think about this, we're all products of those who have preceded us, and I'm no exception. So I will be giving you the benefit of more than, again, 4 decades of clinical experience that will be distilled in such a manner that you will feel very confident after each module to go back to your respective practice and on Monday morning incorporate immediately what I and my all-star faculty will have shared with you. Reason number 3, faculty specialty based. What does that mean? Well, in a nutshell, very proud to share with you the fact that we have a multi-specialty based faculty that consists of surgeons, perio, and prost. Specifically, as surgeons, oral maxillofacial surgeons, we have David Hill, Dr. David Lee Hill. We have Dr. Bart Silverman and myself as surgeons. As periodontists, we have Dr. Richard Myron, we have Dr. George Katsakis, and last but not least, Dr. Hussein Basma, who is basically not just perio trained, but prost trained. So we've got a very solid perio oral surgical based faculty. And last but not least, as a prosthodontist, we have Dr. Philip Hedger, who is currently, and for the last 8 years, been part of my coastal jaw surgery practice. So multi-specialty based, absolutely. How important is that? Well, why not get the best of the best for a core curriculum? Makes all the sense to me. And again, this is what really differentiates us, one of the many things that differentiates us from virtually every program that's out there that is more or less targeting entry-level clinicians and those who are just starting out with implant dentistry and maybe not feeling very confident. Now let me explain a few more items that I think are super important with regard to this reason number 3 to be part of this foundational implant dentistry demystified program, the True Core Curriculum. So what I'm about to say is of tremendous value, and that is that no holds barred here. Total transparency with regard to what we will be sharing with you as specialists. I think there's a basic potential maybe uneasiness about, well, you know, will everything really be explained in detail? Will anything be held back? Well, my goodness, for 34 plus years now of my institute, almost 7,000 alumni, a large proportion of which are general dentists. Now think about this, the feedback we have gotten over these years has been nothing but spectacular with regard to, wow, Mike, this is great. You know, I learned so much. I've been to so many other courses and no detail like this. Just can't believe how much I've learned. So transparency, full disclosure that it's no holds barred. Always have, always will continue to share with you complete transparency, the good, the bad, and the ugly of everything that we do. Meaning complications, of course, will be covered in detail. So, in a nutshell, multi-specialty based faculty, all-star people, super core based, meaning approachable. We have no egos, no pride here to more or less come across as holier than thou. That doesn't happen here at my institute. Reason number 4, we have 4 comprehensive modules with practical content that can be implemented Monday morning. And I think this is super important because think about the time spent with each of these modules, very comprehensive. I mean, we'll work you from morning till evening, each of the 3 days that you're with us for each module. But the beauty is that you will be able to implement on Monday morning solid content immediately. For example, Module 1, you will feel very confident to return to your practice and be able to comfortably extract a tooth and either socket graft that tooth or potentially place an implant immediately, although we won't teach that in that course, in that module. It will be in Module 2, but you will understand the difference of when you can graft versus when you shouldn't graft or wouldn't need to graft. And as importantly, you will be able to confidently place a single implant in abundant bone, both from an analog and digital perspective, i.e. workflow. This is very important. And we will get into quite a bit of detail with regard to what I just shared with you. And last but not least, PRF, from blood draw all the way through application of PRF, will be covered in detail. So that's just Module 1. Now think about it. You'll be able to confidently go back Monday and implement all of these items. And last but not least, which really is first on the list, and that is comprehensive diagnostic treatment planning via CBCT, which is at the heart of everything that we'll share with you. Module 2 will cover multiple implant placement in abundant bone, once again, from both an analog and digital workflow perspective. We'll also look at extraction site management of compromised sites, where socket grafting will be, of course, explained in detail in terms of protocols. And last but not least, guided bone regeneration protocols that will apply to these compromised extraction sites and more. And finally, a PRF review of what we will have covered in Module 1. Module 3, now we get into immediate implant placement. So we extract a tooth, we will cover with you a number of different algorithms, not the least of which this particular application will be such that you'll either look at placing an implant immediately into that socket or grafting it. We'll also cover provisionalization, meaning custom tissue formers as well as crowns. And last but not least, at the heart of this module will be soft tissue grafting around dental implants that will involve both autogenous, i.e. free gingival graft scenarios, in addition to the use of acellular dermis matrix, i.e. eloderm. And finally, in Module 4, we will cover in detail prosthetic steps for restoring dental implants, both screw and cement retained. We will look at mandibular overdenture workflows from both surgical and restorative perspectives. And last but not least, the big topic of peri-implantitis, etiology, treatment, and prevention. So as you can see, 4 comprehensive modules that will be targeted to the individual that is A, just getting started, meaning green with dental implants, as well as B, and that would be folks who are already up and running, but not feeling totally confident about what they're doing and are pursuing something that is very comprehensive, very foundational, and being more or less shared with you by an all-star faculty that is led by yours truly, Pikos. 40 years of clinical practice, still practicing, and my institute of 34 years with now almost 7,000 alumni, all 50 states, 67 countries. Very proud to be able to share with you this very one-of-a-kind, truly unprecedented, comprehensive-based continuum. Reason number 5, the science and art of implantology. Well, let me explain. The science is certainly important with everything that we do. We must be evidence-based, and we certainly are with this entire continuum from Module 1 all the way through to Module 4. And certainly being able to cite evidence-based material for all of our protocols is of utmost importance, and we will do that in a very fine fashion. But that's really not something that will differentiate us necessarily from other programs. However, the art of implantology is something that really we can't pick up, we can't learn from social media, from reading a book, from looking at video, etc. The art really can only come with a personalization of implantology, meaning that you will be able to get firsthand from myself, from me, as well as my specialty faculty. In other words, the true art of what we do. There are so many nuances, so many items, so many, well, as we say, the devil is in the detail, and it certainly is here. From a very foundational perspective, it is critical, in my humble opinion, that if in fact you're committed to learning about implantology and committing to the fact that you want to focus in this arena in a very passionate manner, well, then you will have come to the right place. Because the art is what we're going to share with you in addition to the science, and that can only be done in person. So I take pride in having done this now for some 34 plus years with the Institute, and having trained so many individuals. It's been a real honor and a very humbling experience for me personally to be able to have shared so much of my clinical work with you, my colleagues, and now having an amazing faculty on board as well to share with you their clinical experiences, and again, to pass on the art of what we do, not just the science. But combining the two, to me, is the ultimate in terms of what we need to know. And a true continuum is what we're all about, because yes, in fact, one module to the next, although each of them are freestanding in terms of their material, there is significant continuity from one module to the next, as there should be in a true continuum. Reason number 6, evidence-based and clinically relevant. Now, how important is that? Well, in a nutshell, it's everything. And it's at the heart of the Pikos Institute for some 34 plus years now. Since 1990, I have prided myself in sharing my clinical knowledge as an educator as well as clinician with all of my course attendees. So in essence, what I'm saying is that I've strived to make sure that everything that I have shared with my groups, with all of my attendees, is definitely evidence-based. So important in this day and age, but yet clinically relevant. And this will hold true for this particular continuum, in that myself and my faculty will be sharing with you material that is very definitely clinically relevant, meaning that Monday morning you can implement immediately what we will have shared with you throughout that entire 3-day comprehensive weekend. No question at all. I think it's super important to understand and appreciate the fact that clinically relevant means exactly that. I and we can bore you with statistics, with all sorts of different histological specimens, and you name it, and bore you to death. That's not going to happen. It never has in my entire career, and nor will it happen here. In a nutshell, what we will share with you will be material that is so clinically relevant that you will appreciate immediately that you're in the right place for the right reasons. I have had feedback over all my years of, again, more than 6,800 alumni, all 50 states, 67 countries. Feedback has been amazingly solid and positive, such that, wow, Mike, so appreciative that you have been so transparent with us, that you have held back nothing, that you've shown us your own complications and explained how you could have prevented X amount of them, and or some of them you really couldn't even bail out. You have to just say, you know what, that's it, that's all I can do right now, etc., etc. Well, this will happen again, certainly will be a result of all of our work, and therefore shared with you the same way in this continuum, both from myself and my entire clinical faculty. Reason number 7, economic impact. I think we can look at this as kind of the elephant in the room, in that none of us, or maybe few of us, really feel comfortable about discussing numbers. And in any given course, I think throughout at least my career, courses I've been to, numbers really aren't talked about. Well, I'll tell you, at the Pikos Institute, in every one of our courses, that I do share numbers, absolutely. My own numbers, in terms of what my fees are for any particular procedure. And that will hold true, of course, for the continuum. Now let me just explain a little bit more about economic impact. Those of you that will be part of this unprecedented curriculum, core curriculum if you will experience the following, and that is that with just 2 particular workflows, i.e., number 1, extraction site management, extracting a tooth and either grafting it or placing an implant immediately. And then example number 2 would be placement of a single implant into abundant bone and restoring it. Those 2 workflows alone will result in such an amazing financial plus for you, and that is immediately. That you won't be able to truly comprehend the impact of what I'm sharing with you right now until you actually see your own numbers. And speaking of numbers, it will only take a handful of cases from a financial perspective that literally will cover the entire investment that you will have made in being part of this very unique foundational implant dentistry demystified the core curriculum program. Unprecedented, yes. Impactful economically for you? Absolutely. Reason number 8, the ultimate learning experience. Now, what do I mean by that? Well, with all due respect and with all due humbleness, what we offer here at the Pikos Institute truly is very unique and unprecedented. Since 1990, all of the courses that I have offered to all of you, my colleagues, really includes a very unique experience. Let me explain. We have created an environment that is very, I would say, conducive to learning for so many good reasons, not the least of which is we will make you feel very comfortable right from the beginning, in that you will understand and appreciate the fact that I, as the leader of the Institute and my specialty faculty, will be sharing our clinical material in such a very easygoing manner, meaning just as I'm talking with you now, it's the same mode. There is no hierarchy in terms of holier than thou attitude, etc. None of us have an ego. Zero. I handpick my faculty for good reason. So, with that said, the environment itself, we've been called a mini campus, more or less, of education. And for good reason, because what we offer here is extremely unique, from the fact that what you will experience firsthand will be education in a very straightforward manner, that there's a method to the madness in terms of everything that I have put together over my 34 plus years as an educator and full-time clinician still. What I mean by that is that there is so much material that will be shared with you in a very, very straightforward manner that is distilled from many, many hundreds and thousands of hours of commitment on the back end in terms of study and taking courses, etc., etc. Not the least of which has resulted in very unique hands-on courses, or I should say hands-on programs that are part of our courses, along with high-definition 3x1 slide content, so that our lecture presentations are very beautifully done, but most importantly done from a learning perspective, not so much just to show and tell. And that the total transparency of what we're all about and have been from the get-go, i.e. sharing with you the good, the bad, and the ugly, always. So complications are always covered in detail, and I share with you my own complications, not just from other individuals. So this is very important. When you look at the entire picture, the experience that we have created for our attendees, and this is based, by the way, on feedback that we've gotten over all these years from now almost 7,000 alumni, all 50 states, 67 countries. It's been an amazing experience for me personally as a clinician slash educator, yes. But I think more importantly to me has been the fact that I know firsthand that our course attendees really are able to benefit in such a manner that, no question, we're able to deliver more than we tell you we will. And I think this is important. And I represent not just myself now, but my entire faculty. So we take pride in sharing with you the fact that you will have experienced a learning environment second to none, and most importantly, the content will be absolutely invaluable to you the rest of your careers. So I would say basically these 8 solid reasons to be part of our Foundational Implant Dentistry Demystified, the core curriculum program. That's what it's all about.